You mentioned chemotherapy, and the tendency in small cell, when that was the only option, was for it to respond really well in the first line setting, but not necessarily as well in subsequent settings. Can you talk a little bit about that?
The natural history of small cell lung cancer was something that always fascinated me because you have remarkable responses to these initial chemotherapy agents. Response rates in the 70% range, much better than what we see in other lung cancers to chemotherapy. The responses are rapid, often within days, and can be nearly complete, right? I mean, you can do a scan of these patients after 2 cycles, and there's no apparent evidence of disease. But unfortunately, we know it's coming back in almost every case. Chemotherapy has the ability to kill the majority of the cells and kill them quite handily, but there are some cells that persist. These cells that persist, unimaginatively termed persister cells or drug-tolerant persister cells, have become a huge focus of interest in small cell lung cancer and elsewhere. These cells that somehow adopt a dormant state are able to evade the initial insult of chemotherapy, and then when the coast is clear, able to come back and thrive. We understand part of what makes those cells tick, right? That they're not as prone to cell division, they're not as active as these other cells, so that makes them less vulnerable to chemotherapy. They seem to be very plastic, and when I use that term, I mean they can kind of adopt different fates, and so depending on what you're treating with, they can shift to a different fate that's less vulnerable to that, and they can also repopulate the tumor. Not going so far as to term them as stem cells or cancer stem cells, but kind of a similar notion. These are the difference between a really nice response that might last a few weeks and seemingly cure in patients. And so this last percent or 5% or whatever it is when you quantify it is a huge unmet need in small cell lung cancer, and trying to figure out therapies that are not only effective in the way chemotherapy is, but effective at eradicating these persister cells, I think is where the field is going in the next 3 to 5 years.
So I'll be brave if you're brave. I'll be brave, but only